We're going to do some facial rejuvenation with Botox and fillers. So what we talked about today are, if you could raise your eyebrows for me. She's got some wrinkles there, very faint wrinkles in her forehead, which she doesn't like. And then bring your eyebrows together for me too. And then she's got the angry 11s there in the middle, which is probably the most common reason why people get Botox, to be honest. And then give me a big smile too. So not too much in the way of crow's feet. Some people have wrinkles right here, but you can do as much or as little Botox as you want in that area. We're gonna avoid that today. So once again, raise your eyebrows up. So some Botox right there. Bring your eyebrows together. And then right here in the corrugator muscle right there. And the procerus muscle. And then lastly, we're gonna give you a little bit of volume right here in your cheeks. So I'll show you. If you look right here on the right side, this is helpful to raise up the cheeks a little bit, and it can help to efface this wrinkle right there. And same thing on this side. Not a very prominent wrinkle. She's already got a lot of facial volume here, but if you could raise that up, add some volume right in this area right there, it can efface that wrinkle without giving the sort of swollen look that some fillers can provide. So we're gonna start with the filler right in this area, and then Botox up here, and then Botox right there. Okay. And what I like to do is draw a line right here from this area called the tear trough right there, and then also from this area called the lateral canthus. And it kind of creates this sort of rectangular area right there, which really you get the most bang for your buck from any filler. And the filler we're going to use is called Voluma. It's a very dense, long-lasting, and very cross-linked hyaluronic acid filler that's going to last for a long time. So this will be a nice lift here. So I'm going to inject right here first. So right here. Okay, so now the same thing on this other side. I feel where the bone is, right there. Can you look up for me? Good. I gently lift, just like this. I can see a little vessel right there. Okay, ready? 1, 2, and 3. Little poke, little poke, little poke. Good. So you can see here I've added some volume to that ridge below the eye, and we filled it in nicely. Added some volume here to the lateral cheek too, all with only half a vial of filler. And now we're going to be doing a little bit of Botox here, so if you could raise your eyebrows for me again. Good. You can see a little bit of the horizontal rhytids there, wrinkles we're going to get rid of. And bring your eyebrows together. And then a little bit of the angry 11s. Not too bad, but enough to put a little smidge of Botox there. So why don't we start out with the angry 11s. And so bring your eyebrows together again for me. Great. And so I've already sterilized the area. You can relax for me. And we're going to follow this muscle called the corrugator muscle right there. And usually I do 3 different injections. So this will be number 1. 2 units in each one. Number 2. Good. And lastly, number 3. 1, 2, and 3. Perfect. You did great. And then do the same thing on the other side. Yeah. So raise your eyebrows for me again.
Mm-hmm.
Okay, so we're just going to follow the wrinkles here from right to left. And of course avoid any vessels. And then 1, 2, and 3 little pokes. All right. Doing great. Good. Raise your eyebrows again. Perfect. Right there. 1, 2, and there's 3. Good. Wonderful. So once again, it takes about 4 to 7 days or so before you really get the full experience of the Botox. And sometimes we like to have the patient come back in and reevaluate after the Botox takes effect, and you can fine tune some things. But I think that we did a nice job here for the corrugators, the procerus, and then of course the frontalis muscle with those horizontal forehead wrinkles. And the filler too, the filler you actually overfill by about 10 or 20%. And then over time you're gonna metabolize this a little bit and the swelling will go down. So I usually recommend that you ice the areas where you had filler placed, and then no exercise for about 24 to 48 hours just to make sure that the Botox stays in the right place. Usually it's pretty well tolerated, and like I said, I think it'll be a nice result. So thanks very much.